Welcome to the University of Utah. We are currently sitting on the patio of the hospital, so I am going to take you on a tour of our facility, which includes our hospital and our clinics. The neurology inpatient services are going to be primarily located on the neurology acute care floor, which is the NAC. We mostly share this floor with both neurosurgery and ENT. All of the nurses on this floor are neurology trained. We also have separate EMU or epilepsy monitoring unit beds, which are currently hosted in the rehab hospital, but have plans to return back to the main hospital once we have additional space. Welcome to the call room. As you can see, we have the essentials, bed, computer, snacks, which Carol's replenishes often. We have both healthy and unhealthy options for those 3 a.m. cravings. So down the hall from the neurology acute care unit, we have the neurocritical care unit. This is where both neurology and neurosurgery critical care patients are housed. You will rotate here as part of your neurocritical care rotation.
The neuroradiology program at the University of Utah is one of the most competitive in the country, and the faculty are national leaders in the field. We can review cases directly with our neuroradiologists at all our primary clinical locations, including the hospital, as well as CMC and IMC clinic locations.
The University Hospital is connected via a multitude of tunnels to all of the important buildings that you will need to access. Primary Children's and the Moran Eye Center are just behind me.
We provide lunch to our residents most days of the week, but we also have multiple other options to purchase food on campus. We have a very well-stocked cafeteria at the main hospital, as well as multiple cafeterias at all the connected hospitals. One of the best features of the hospital is our 24-hour Starbucks. Here you have all the things you would expect in a regular Starbucks, as well as additional food options, and it is all available 24/7.
We're now standing in front of the Huntsman Cancer Hospital. This is one of the towers. This is where you will see patients with primary neurological malignancies as well as neurological complications of cancer treatments. Because of their very high volume, you will be very well versed in how to manage these complex patients.
The Craig Nielsen Rehabilitation Hospital opened in 2020. It blends state-of-the-art technology with a highly personalized rehabilitation approach to restore and optimize function. Many of the patients at the University of Utah Hospital are discharged here, and you will provide consultation to some of the patients who require ongoing neurological care but have transitioned to the rehab hospital.
Welcome to the Clinical Neurosciences Center. This is where you will have most of your clinics. About half of our faculty have their clinics here, and the other half will have their clinics at the ANC, or Imaging and Neurosciences Center. Not only do we have an excellent clinical space at the Clinical Neurosciences Center, 24/7 radiology support, IR suites in this building, but we also have amazing staff. Our staff is here to help you, and as a resident, you will have your own dedicated clinic to support you in your continuity clinic. This is the room where all of our physicians stay when they're in between patients. So this is where you'll be writing some notes, staffing clinic. We also have a pharmacist who is here all the time in clinic, available to support you with your questions about medications and prescriptions. So this is another important connecting corridor. We have a confluence of corridors that go to the University Hospital, the Clinical Neurosciences Center, the Rehab Hospital, and the Huntsman Cancer Hospital. So if you want to take this in the winter or at night, you can absolutely use the corridors without going outside.
We hope you enjoyed this tour, and we are excited to meet you.